I've been saying for a number of weeks now that I believe health has to be the number one priority, not just here at the state election, but also in the federal election. Without your health, what do you got? And unfortunately, the years that I've been sitting behind the microphone here on 6PR, the stories that I have heard from you and the emails and the correspondence that I have heard from you, our health system is struggling. On the whole, we are lucky to live in Perth, Western Australia, and we all know that. But some of what you would expect to be delivered to the tax-paying public of Western Australia is falling short. Now, over the weekend and throughout today, the Labor Party and the Liberal Party have been making more announcements and promises to improve health. For example, Labor put $100 million on the table yesterday to upgrade the emergency department at Royal Perth Hospital. The Liberals, they're hoping their urgent care plan would be able to cut ambulance ramping by 20%. Well, let's go to Dr. Michael Page, because I know that he has probably got the longest wish list in the world, but we'll get his take, his assessment, and where the parties could make improvements. He's the WA President of the Australian Medical Association. Dr. Page, good afternoon.
Good afternoon to you, Ollie.
Good to see we're finally talking about health in the state election, Michael.
Look, I completely agree with your assessment, Ollie, that health should be the number one issue for both the state and federal elections. The public health system, the public hospital system in Western Australia is indeed in a dire state. Access to care is more difficult than it's ever been. And yes, the AMA does have a very long wish list for what we'd like to see happen with health in Western Australia, but fundamentally it just boils down to one thing, and that's access to care. People being able to access the care that they need where and when they need it, and at the moment that is a very difficult thing for many patients to have.
And it doesn't matter if you've got all the money in the world, you've got no money at all, Dr. Page. As you say, you need to be able to access that care.
That's right, and at the moment we've got people waiting for transfer from the ambulance into the emergency department. They're waiting because the people in the emergency department are waiting to transfer onto the ward because there's no beds. Many of the people in the beds on the hospital wards are waiting for transfer into some sort of step-down care, whether that's hospital in the home, whether it's an aged care facility, or whether it's some other kind of step-down facility, because we just simply don't. And of course, we've got people waiting for elective surgery, and we've got people waiting to be seen in public outpatient clinics, in some cases for years for a first appointment. So it's very clear that the hospital system, the healthcare system, particularly on the public side, is really underdone at the moment. And so what we want to see is visionary leadership from both major parties and really a clear idea of where the health system is going in this state.
Do you reckon we're starting to see any of that? Some of the ideas that have bubbled around, and let's start with the $100 million commitment to improve the emergency department at Royal Perth made by the Premier yesterday. I recall Dr. Page being at his press conference, I think it was back in 2017, with promises to upgrade Royal Perth Hospital, and years before that, when the shoe was on the other foot, the Liberal Party saying they were going to knock down Royal Perth Hospital. Is Royal Perth Hospital, it's needed, don't get me wrong, but are we just throwing almost bad money after what is now becoming a pretty old hospital, Dr. Page?
It's a very old hospital. It needs either major refurbishment from top to bottom or replacement. We do need an inner-city hospital. I think every major city in the world has an inner-city hospital. It's an important strategic location for a major hospital. So Royal Perth Hospital is something that should survive into the future. But an upgrade to the emergency department, refurbishment to the emergency department, really that's just necessary maintenance. I don't think that's going to necessarily improve the type of care people can access. It will make the working environment better for our health workers at Royal Perth. It will make it more efficient. It will enable it to treat more patients at once, but it's not going to solve the core problems of capacity.
So do we need to be as bold as building new hospitals, Dr. Page?
Look, we think that the system across WA, the public system across WA needs many more beds to not just meet the care needs for patients now, but also into the future over the next 10 or 20 years. If we're not building more hospitals, if we're not building more wards on our existing hospitals in the near future, we really will have a catastrophically underdone public hospital system in a decade or two. There's no doubt. And hospital building takes time, so that planning does need to begin.
I did see the Premier also point the finger towards the fact there are a lack of GPs that bulk bill. He's trying to shift that towards the responsibility of the federal government and say nothing to see here, not the state's responsibility?
General practice is funded largely through the federal system via the Medicare rebates that patients receive, which have been under-indexed for decades, and that's why bulk billing rates have reduced. But part of the problem with access to general practice is GPs, is young doctors not wanting to train in general practice in the numbers that they used to. What we've seen in Victoria is the state government offer incentives to junior doctors to leave the hospital system and go into general practice training, which often involves a significant pay cut. So the state government's actually topping up their salaries so that they go into general practice training. And that's been really successful. So for state governments to say that they don't have a role in ensuring there's a strong general practice system in the state is not true. They can have a role and they should have a role, because ultimately a strong general practice network, a strong network of general practitioners that patients can easily get into, is what prevents patients needing to go into the public hospitals in the first place. So prevention is always better than cure, and I think the state government should take more of an active role in ensuring we have strong general practice in this state.
The Liberal announcement of expanding the urgent care clinics, putting $72 million towards that method, they claim ambulance ramping could be cut by 20%. Do you share their optimism?
Look, I think urgent care type presentations aren't the sort of people who are waiting in an emergency department for a bed on the ward, which is what causes the emergency departments to back up. Anything that's urgent care but not needing hospital admission, sure, that might be a pathway, but it's not going to solve the problem of ambulance ramping. It's not going to solve the problem of not having enough hospital beds. Urgent care, it could be part of the solution. We need a bit more evidence to that. But it's not going to solve the core capacity issues that we have.
I think some of those announcements by the Liberal Party, and I made mention of it the other day, in regards to trying to cut down paediatric service wait times is important. They're obviously still wanting to see this as some sort of a referendum at the state election, Dr. Page, about the location of the Women's and Babies Hospital. Health is obviously going to be a sore point for the government of the day, and it's something obviously the Liberal Party believes it can exploit. But what else are you wanting to hear? What other promises are you wanting to hear announced or made by the opposition or the government in the lead up to March 8?
Look, what we've heard today from the government is a couple of potentially quite positive things. We've heard about funding for better access by general practitioners to hospital specialist guidance, which might ease outpatient waiting lists. So I think that's a good thing. I think there is a role for the virtual ED expansion that's been announced today as well by the Labor Party. That may well reduce pressure on the system overall. But what we're really waiting for is ambition, Ollie. We're waiting for an ambitious plan for the state's health system that actually predicts future need. And actually recognises and acknowledges the fact that we don't have enough physical beds. You can't provide every type of care in the home. Hospital in the home is important. It is a part of the picture, but you can't take out someone's gallbladder in their bedroom or in their kitchen. There's a lot of care that needs to be delivered in a hospital where all the specialists, all the allied health, the nursing is all there in one site, and you can actually deliver lots of care more efficiently in a hospital than you can at home. So there's a role for both, but we do need more hospital capacity. So
basically, we need to rip off the Band-Aid and confirm that we're going to go in for surgery.
I think that's probably a good way to put it, Ollie.
Good on you. Dr. Page, thanks for your time.
Anytime.
He's the WA President of the Australian Medical